Now, Kenya Airways today suspended flights to China over coronavirus fears. This as it emerged that the Kenyan student quarantined at the Kenyatta National Hospital does not have the coronavirus, but the usual common cold. And as Dorcas Wangira reports, Kenya has heightened and enhanced surveillance at the country's points of entry as the death toll from the outbreak hits 213 in China.
The student, who had been under investigation at the Kenyatta National Hospital, may have been declared coronavirus free, but the government continues to heighten surveillance and scale up capacity to handle the likelihood of an unprecedented outbreak. All passengers, whether departing from or arriving into the country, at all entry points will have to be screened. Expansion of the isolation units is part of the country's preparedness and response measures. The president also supervising the multi-agency and ministerial response to the global threat. WHO has declared the novel coronavirus outbreak a public health emergency of international concern, not because it lacks faith in China's capacity to deal with the virus, but also the situation in countries with weaker health systems.
I want to give Kenyans confidence that we have systems that are working, we have teams that are prepared and ready.
The national carrier Kenya Airways suspended its direct flights to and from Guangzhou, China. However, flights to Bangkok, Thailand, where there have been 19 cases confirmed, are still operational. Other destinations to Shanghai and Beijing are through codeshare partners. Likewise, Rwanda Air has suspended flights to the Chinese capital, but will maintain flights to Mumbai, India.
The continued increase in cases and the evidence of human-to-human transmission outside China are of course both deeply concerning, although the numbers outside China are still relatively small. They hold the potential for a much larger outbreak.
The WHO declaration means that the health board will have to mobilize financial and political support to contain the outbreak. It also means the WHO will have to support lower and middle income countries which cannot cope and have no tools to spot it, to strengthen surveillance and prepare them for cases, as witnessed during the 2009 H1N1 swine flu outbreak, the polio and Ebola outbreaks in 2014, and the 2019 Ebola outbreak in the DRC.
But we're working very closely with China and other countries, and we think it's going to have a very good ending for us.
Kenyans in Wuhan, who are still in lockdown, are calling upon the government to consider their plight. Jeffrey, a Kenyan student of the Wuhan Botanical Gardens from Karachuonyo, says they're running out of food rations.
Our cry is that the people back home and elsewhere can actually just keep us in prayer, that God will actually keep us safe, because we really need those prayers right now, and also just to ensure that our mental health is actually in place, because the entire situation can actually lead one into depression.
Many countries such as the United States and the United Kingdom have begun to evacuate their citizens from China. As of January 31st, 2020, there have been 10,000 confirmed cases of the novel coronavirus, with 98 cases reported in 18 countries outside China. 213 people have died. Dorcas Wangira, Citizen TV, Nairobi.